Hi, Dr. Deepak. Very happy to meet you.
Good evening, ma'am.
And first of all, congratulations for this mind-blowing victory, I should say. First rank in super specialty exam. So
Thank you.
we are meeting for the first time. So would like to know more about you. Can you just introduce yourself, like in the profession, personally as well as professionally? Where are you from? How did you go through, or where did you study your MBBS, MS, and all these things? Can you just give an introduction of yourself?
Yes, ma'am. My name is Deepak Suresh Kumar. I did my. I'm from Chennai. I did my MBBS from CMC Vellore,
Okay.
and my MS. I'm just finishing my MS from PGH Chandigarh.
Okay. Okay. So you just finished your MS.
I'm
When did you
finishing. I'm
finish your
finishing.
MS?
I've cleared my exams. My course is completing on June 30th.
June.
Yes, ma'am.
Okay. So last year also, I remember the person who qualified part two was still doing his MS, just passed out. So I think you PGI people are in habit of qualifying the exam while you are still in MS. So you are telling you don't have any practical experience in CTVS?
Ma'am, in CMC we have a 2-year bond period after our MBBS. So one of the years I did it in the Department of Cardiac Surgery in CMC, ma'am.
Okay. How
So
many
that
months?
the 1 year, ma'am.
1 year you worked in CTVS department at Vellore.
Yes, ma'am. Predominantly in ICU, in the
Okay.
cardiac surgery ICU.
Okay. So you used to scrub in the OR for the cases?
No, ma'am. No, ma'am. It's just post-op care and some pre-op care, ma'am. But mostly the post-op care.
Okay. That was before you joined your MS.
Yes, ma'am.
Okay. So pretty good time you spend in the ICU. Okay.
Yes, ma'am.
And is that the time when you developed an interest for CTVS, or was it your passion even before that itself?
Ma'am, I really developed an interest in CTVS during our pediatrics postings, ma'am, in our MBBS time. Because CMC had a very big caseload of pediatric cardiac cases. So that is when
Okay.
I developed my interest in CTVS. And then I had the opportunity to do my bond in CTVS also. So then
Okay.
it was, I mean, I was fully sure that I wanted to do CTVS itself before joining MS only.
Okay. Okay. So, how was your studies like? Do your MS exam must have been finished just recently, no? Last month or
Yes,
so?
ma'am. Yes, ma'am.
Okay.
Yes, ma'am.
So, how did you prepare for your MCH or the super specialty entrance? What was your pattern of study? How did you prepare? What were the materials you used?
Ma'am, so actually when I started preparing towards the middle of my fourth semester. So that is maybe a year back. So that was when Marrow was just starting its videos. I had actually started preparing from other sources,
Okay.
from other videos and such. But once I had used Marrow for my PG preparation also, ma'am. So I was very well versed with the module, with the Marrow system. So once Marrow started putting out its videos, then I saw all the Marrow videos for cardiac surgery itself. I saw all of Sir's videos for general surgery, and PJ. Our major exposure is in surgical gastro, ma'am, and our curriculum is also geared towards surgical gastro. So for that, I had seen surgical gastro videos from Marrow also. But as such, my MCH preparation was predominantly from the videos and Cuban. I have not read any cardiac surgery textbook per se for the entrance, ma'am. My predominant preparation is from the videos only. I had made notes from all videos, and from that I had prepared.
So you attended the Marrow videos of CTVS.
Yes, ma'am. All the videos.
Okay. Okay. So I would like to know, because last year I presented the videos. So I would like to know which all topics were there in the exam, which you think would be better if more coverage is given in the videos, or which portion was not covered in the videos.
Ma'am, the videos were actually adequate, ma'am. There was nothing which came outside the videos per se. Otherwise, weightage wise, this time there were a few questions from the coarctation part. aortic dissection, and IABP. These three had IABP had around 4 questions from IABP itself had come. But otherwise, the videos were sufficient because I have not read anything outside the videos, ma'am, outside the modules, and there was no question that I could not answer or which I have not heard of, which was outside the video. I had skipped only one question. I attended 79 out of 80, and that one question also was not a cardiac surgery question; it was a general surgery question. So I think the videos are more than sufficient for clearing the exam.
Okay. So I think because you spent 1 year in ICU, you could grasp whatever was there in the subject. Otherwise,
Yes.
without practical experience, it's really difficult. Because when I talk to students who are direct from MS, who don't have absolutely any experience in CTVS, they really find it difficult. When they are faced with practical questions, post-operative scenarios, especially. Like IABP and all, you are telling because you had an ICU experience, you know what is IABP. That's why you say that you have not come across any questions which you haven't heard of. But it may be because of your practical experience. But I think in super specialty, a NEET exam may not be that much importance of a practical experience, but this institute exam, I really think
Definitely helps.
some experience will help really.
Yes.
Yeah, more of practical questions are there. So now, after getting first rank, where do you plan to join?
AIMS Delhi, ma'am.
AIMS Delhi. Okay. So a good choice. And you have been in in Chennai and Chandigarh. So now moving on to Delhi, right? So and do you plan to study more in pediatric cardiac surgery because you were interested in CTVS right from the beginning,
Ma'am, as
seeing
of
the
now, yes,
pediatric
ma'am.
cardiac cases?
As of now, yes, I am planning to do more of pediatric cardiac surgery, but once I get exposed more to the subject, then I'll decide.
Okay. So AIMS is a good choice then because I passed out from AIMS 11 years back. So that was my alma mater also. So there, I think the 60 to 70% of cases are more on pediatric side. Compared to adult cases, pediatric is more there. And you get to see every volume under the sun in AIMS regarding the pediatric cases. So I think it's a good choice. And any message, anything to be said to the next year students, like what is your advice regarding those who are passionate about taking CTVS, the method of study or any materials or anything like that? Would like to say?
Ma'am, what I tell all my juniors here also is that you can take time to decide your specialty, but once you decide that you want to do a particular specialty, then you have to go all out and study. There is no point wasting time and deciding to do something else. Once you decide I want this particular specialty, whatever it may be, then we have to put dedicated time and effort into studying, and we have to follow one particular platform, Marrow, for example, because there is no point reading entire textbooks, because one thing we cannot memorize, and second thing is there is no focus study, ma'am. It's very difficult without seeing to understand what the textbook is actually talking about. So that would be my advice, to follow a platform like Marrow. And once we have decided, you can take time to decide, but once you have decided, you have to start studying all out. You need to start all out preparation.
Okay. How many hours did you study per day, Deepak?
Well, so basically my predominant preparation was in 4th and 5th semester, ma'am. Maybe 1 to 2 hours a day, not more. I'm not a person who sits and reads continuously, ma'am. 1 to 2 hours a day, one video a day also if we can do, we can finish the entire thing in a month or so, ma'am. Because I had to study general surgery also along with the preparation for MCH.
Yeah. Did you write NEET?
No, ma'am. NEET, this time NEET has not come out, the NEET dates. And the previous, I have not written any previous NEET.
Okay. So wish you all the best and let
Thank
your
you.
focus be like that, and hope we can meet sometime in future. Okay.
Yes, ma'am. Thank you, ma'am.
So thank you so much, and hope our study platform and our videos helped you very much. And we hope our videos will help the future batch of students also. Thank you, Deepak.
Yes,
Thank
ma'am.
you so much.
Thank you, ma'am. Thank you so much, ma'am.